Ever wondered about the diverse landscape of common pain relief medications? How do they differ and what makes each one unique? Dive into the world of non-steroidal anti-inflammatory drugs, or NSAIDs, and let's focus on one in particular: Flurbiprofen. Flurbiprofen, like its more well-known cousins ibuprofen and naproxen, is a non-steroidal anti-inflammatory drug. These medicines all share a common purpose. They reduce inflammation and relieve pain. But what sets Flurbiprofen apart? Flurbiprofen has a unique advantage in its duration of action. It provides longer-lasting relief compared to other NSAIDs. This means fewer doses throughout the day and a more sustained relief from pain and inflammation. But like all NSAIDs, Flurbiprofen isn't without its risks. It can cause stomach irritation, which means it should always be taken with food. It can also interfere with the effectiveness of certain blood pressure medications. Therefore, always consult with a healthcare provider before starting any new medication, including Flurbiprofen. Now, let's contrast this with ibuprofen, arguably the most well-known NSAID. Ibuprofen is well regarded for its quick onset of action, providing relief within 20 to 30 minutes. However, it tends to be shorter acting than Flurbiprofen and may require more frequent dosing to maintain the same level of pain relief. And then there's naproxen, another popular NSAID. Naproxen's claim to fame is its long duration of action, similar to Flurbiprofen. However, it may take longer to start working than both Flurbiprofen and ibuprofen. So, to summarize, Flurbiprofen offers longer-lasting relief compared to other NSAIDs, making it a great choice for those needing sustained pain and inflammation relief. But remember, it can cause stomach irritation and may interfere with certain blood pressure medications. Always take it with food and consult with a healthcare provider before starting any new medication. As we explore the world of pain relief medications, remember that each one has its unique benefits and risks. Understanding these can help us make informed decisions about our health. So the next time you reach for that bottle of pain relievers, remember, they're not all created equal.